computer screen. And now it is 8 o'clock. We are going to start our physical therapy. This is a totally new major for you. I am Ke Shanghong, and I'm working in the rehabilitation department more than 10 years. These two class, I will share the introduction of physiotherapy to you. Before class, I want to know that how many of you in your class? How many students in your class? I can see 15 students in this Tencent room. So you have 15 students, right?
Yes, 老师.
And how is your Chinese? Can you understand Chinese? Can you understand Chinese? Yeah.
可以一点点。
一点点。So in this class, most of the knowledge maybe I will share in English, but some of the knowledge maybe in Chinese. Can you so maybe you need to listen carefully.
Yes.
Do you know anything about physiotherapy before? And now you are in grade 3, right? Or grade 4? Grade 4. Do you know any knowledge or anything about physiotherapy? I want a student to answer this question. Do you know anything about physiotherapy? You can type your answers on the screen, on the chat. 欧阳娜娜 Physiotherapy helps to restore movement and function when someone is affected by injury, illness, or disability. Yes, very good. Yes, we know we have a lot of ways to deal with injuries, illness, or disability. And physiotherapy is also one of the effective way. So Oyanana is very good. And this answer, I believe, I also agree with you. Ning Yongfu, number 16. Let me see your answer. Physiotherapy, also known as physical therapy, is a healthcare profession focused on assessing, diagnosing, and treating physical impairment, disabilities, and pain through physical means. Yes. Exercise, massage, and various treatments based on physical stimuli. Li Yitong, yes, Li Yitong's answer is also, Li Yitong's answer shows us we can choose what kind of methods to deal with disease. According to this class, we can use exercise training or massage and some other treatments such as physical modality therapy to deal with some disease or deal with the pain or deal with the disability and impairments. Peng Weiman is number 1, right? Peng Manwei, number 1. Treat injuries, disease, and conditions that affect the muscular. Yes, but not Peng Manwei. Physical therapy can deal with musculoskeletal system, but not only to deal with musculoskeletal system. In fact, physiotherapy can deal with all systems of our body. So the central nervous system, or the peripheral nervous, we can also deal with disease like that. And also some disease inside our body, such as the heart disease, the heart stroke, right? Heart stroke. We can also use physiotherapy to deal with heart stroke, but not in the acute phase of the disease, but after the doctors in the in which department? I mean doctors in the cardiovascular department deal with the acute phase of the heart stroke. After that, the patient may feel better and the life of the patient has been saved by the doctors in the cardiovascular doctors. After that, the patient still feel weak and they also feel afraid to go back to their life or even do some exercise, right? Many patients after heart stroke, they are frightened and they are very afraid to return back to their normal life, and they are afraid of any exercise can result to another or a second heart stroke. So they just stay at home and they are afraid of doing any exercise. But to those patients, we can use physical therapy. One method is called movement therapy. That is one part of physical therapy. Movement therapy is one part. Is one of the most important. Most important. importance of physical therapy. Movement therapy is one of the most important part of physical therapy. So we can use movement therapy to help the patients after heart stroke to do some exercise according to their conditions. And even when they're still in the hospital, when they're still in the cardiovascular department, we can go to the cardiovascular department, the therapist of our department. Therapist, do you know therapist? Therapist is the person who offer therapy to patients. So we have physical therapist, and we have occupational therapist, and we also have speech therapist. There are different therapists in our department. So physical therapists can offer movement therapy to the patients after stroke. They can go to the cardiovascular department and offer some movement therapy, help the patient to do some exercise under guardianship. So am I clear? So the patient will be very safe, and they can they're lying on the bed or sit on the bed, or just stand up beside the bed, but with but under the guardianship. That means when we offer the movement therapy, we need to measure the blood pressure of the patient, and we also need to know the heart rate of the patient. And wait a minute, I need to check 饱和度 and the blood oxygen saturation, right? So when the physical therapist offer movement therapy to the patients who still stay at the cardiovascular department, we also need to know the blood pressure. Blood pressure, blood oxygen saturation, and the heart rate of the patient, so that we can make sure that during the treatment the patient is safe, right? So this is what we can do, not only to the musculoskeletal system, but also the neural system. For example, people after stroke, you know that you have learned the stroke, right? After stroke, what kind of dysfunction the patients will have after stroke? You can type your answers on the screen, on the chat. What kind of different dysfunctions that a patient will have after stroke? What functional impairments or disabilities may patients experience dysfunction? What dysfunctions may patients experience after a stroke? You can answer this question on the chat. Physical dysfunction and speech. Yes, very good. 花群飞. Very good. Physical dysfunction, the limb, right? One part of our body, the limbs, maybe they can't move their arms and they can't walk and they can't lift their legs. Yes, Li Yitong, good. Speech dysfunction. People cannot speak and they just can't communicate with others. Sensory changes. Yes, of course. Sensory is also one important part. Dysfunctions after a stroke, especially the sensory changes may have a bad effect to the patients after stroke that will delay the function recovery, especially the proprioception. Proprioception. Do you know proprioception? If a patient has a bad proprioception, they cannot feel their feet when they walk or when they put their feet on. In fact, they put their feet on the floor, right? On the floor, but they can't feel their feet. So they can't tell where their foot is. So that when the patient stand up, they don't know where is my feet, so they cannot feel it good. The proprioception has some problem. The patient has some problem with the proprioception, so they cannot walk easily, or they have some difficult when they training the walking function. Understand? So the proprioception is also a sensory changes after stroke. We need to wait a minute. I need to answer a phone. Wait. 我们那个是改为线上了呀，不是说空调坏了吗？对啊，课时号，腾讯会议号吗？腾讯会议号，哎，对，腾讯，我看一下啊，是2个课啊，腾讯会议号，我昨天不是已经有老师搜集过了吗？我们都发过了。有老师已经搜集过那个电子文档，腾讯那个文档我们都发了，470245095，传给张老师，张老师吧，我传给你啊，好，那我用 QQ 传给你，So I'm sorry I'm back. Just now I answered a phone from a teacher in your school and said there's someone check whether we are having a class. So very lucky that every one of you is in this class. So we'll continue with our class. Let me check your answers. So sensory changes is also one part of the dysfunction after stroke, and especially the proprioception sensation, right? If a patient has a problem with the proprioception sensation, maybe he is no longer knows how to walk, and we need a lot of exercise and a lot of training to tell them, to help them recover the proprioception sensation. Vision changes. Yes, vision changes is also one dysfunction after stroke. The patient cannot see one eyes. They cannot see, right? Cognitive and emotional dysfunction. Yes, very good, Pen Manwei. Cognitive and emotional dysfunction. And these two dysfunction is not that easily to know, because many people just focus on the physical dysfunction, right? They just want to know, can I stand again, or can I eat by myself, or can I wear clothes, take on clothes, or take off clothes by myself. So they just focus on these things, and many of the patients and the family members of the patients and even the doctors may ignore the cognitive and emotional dysfunctions. So you will be a very good doctor, I believe that, because you realize that cognitive and emotional dysfunction is also very important. If a patient has a cognitive dysfunction after stroke, that also will affect the process of rehabilitation, right? Because whatever you tell him and whatever you tell him to do, he may not understand what you said. For example, the physical therapist, the patient in our department, they after a stroke, they will go to the treatment department every day and receive physical therapist, physical therapy and occupational therapy, and some patients will receive speech or swollen therapy. But if the patient has cognitive dysfunction, when they do the exercise, the patient tell him, please lift your arm. The physical therapist will training the arms and the legs, and will training the balance functions of the patient. They may tell the patient to sit straight, or tell the patient to touch my hand. You know that, touch my hand. The physical therapist will tell the patient touch the hand to training the balance function, or tell him to do some exercise of the arms of the joint. But the patient cannot understand what the physical therapist say, so they cannot cooperate with the therapist. That will affect the process of rehabilitation. Other patient maybe just 3 months, and they can have a very, very huge progress during the therapist. But this kind of patient, maybe after half of the year or even 1 year, they just lying on the bed and know nothing. So it is also very important. Emotional dysfunction. Many people after stroke, about 30% of the patient after stroke will have the emotional dysfunction. Some will become very anxiety, and some will become depression. Some of them just crying every day. And when they feel bad, they cannot go to the treatment department to receive regular therapist. So we need to offer some drugs to them. To offer some drugs to regulate their emotions. Yeah, I see all of the answers from you, and I feel that you are really good. You are really good, and you know a lot. You have studied before. You have managed the knowledges that you have studied before. So from all that I tell you, maybe you already have a feel what physical therapist, what physical therapy can do, right? So we can deal with almost all the systems of all the disease of our body, from the head to the foot. We can deal with almost all the disease. Now, this class we are going to study this 5-part overview of the physical therapy, and the most important section 2 and section 4. It is exercise therapy, physical modality treatment, and manual therapy. These 3 therapy is the key point of physical therapy, and it is also the only 3 part of physical therapy. So manual therapy, maybe there will one teacher to teach you in especially in 2 class to teach you the manual therapy. So in this class, we are not going to learn manual therapy. And the physical modality treatment, also there were 2 teachers will share the a specific knowledge of, about all the physical modality, the sound, the light, and the sound, the light, the electricity, and the pressure, and so on. Exercise therapy, and there are also 2 teachers will give you class, 2 teachers give you class to learn all kinds of different exercise therapies. So in this class, we have some goals and the instructional objectives in this class. First one, we must master the definition of physical therapy, physical therapy, and the role of exercise therapy. Just now, we have talked a lot about physical therapy, what we can use physical therapy to do, and what kind of disease we can deal with physical therapy, right? We have a lot of discussion, and you give me a lot of good answers, and I believe that you have know the important role of exercise therapy. And we should be familiar with the classification of exercise therapy. You know that exercise therapy is one most important part of physical therapy, and there are also a lot of different classifications. For example, the therapies to deal with the motion of the joint. This is our shoulder joint, right? The shoulder joint. And if you have some disease with the shoulder, maybe the arthritis, the shoulder pain. Shoulder pain, you know that. Shoulder feel pain and periarthritis of the shoulder, and they feel pain of the shoulder, and they cannot move the shoulder smoothly. They can't lift their shoulder or do any actions of the shoulder. So we need to, if a patient like that go to your department, what kind of therapies you can offer to him? I think first of all, he has pain, right? So we can offer him some modality therapies. Modality therapy, also called physical modality treatment. So we can give him some modality treatment to deal with the pain. And he also has the dysfunction of the shoulder, and he can't move the shoulder smoothly. So we need to offer him some exercise therapy. That is the exercise therapy to deal with the motion of the shoulder. We need to help him to lift the shoulders, to recover the range of the motion of the shoulder, right? So that is the method can be used. That is the method can be used during the in this disease. And also, if the patient has pain, maybe because of the pain, he cannot move the shoulder for a long time, maybe for 1 month, 2 months. So the muscle strength of the shoulder may be just reduced, right? The muscle of the shoulder decreased. So we also need to give him some movement therapy to help him enhance the strength of the muscle. So there are different classification of exercise therapy. Also, just now we talked about stroke, right? The dysfunction after stroke. So maybe the speech therapy that is deal with the communication problems of the stroke person. Maybe speech therapy is not part of physical therapy, but after stroke, patient cannot turn around by himself, cannot take on the clothes by himself. So we also need to teach the patient to deal with these problems. So this part of treatment is also belong to exercise therapy. And also we need to use some neurodevelopment treatment that is also called NDT, neurodevelopment. Neurodevelopment, neurodevelopment therapy. You can see on the chat box, neurodevelopment treatment is also part of exercise treatment, but it is usually used in the people that have some disease, some central neural disease or the peripheral nervous system disease. So we use neurodevelopment treatment. It is also a part of the exercise therapy. So we need to familiar with different classifications of exercise therapy, and we know in what kind of disease we can choose the proper exercise therapy to the patient. The classification of physical factors. We know that a lot of factors in our world can be used to deal with disease. The sound, right? Sound. We can hear from other people, but there are some sound that we cannot hear. It is called ultrasound. So ultrasound therapy is one part of physical factors. It can be used to deal with disease. For example, if you have a surgery and there is a scar left on your arm, and you feel the scar is very ugly, and you want to make the scar you want to deal with the scar, so you can go to the rehabilitation department and receive the ultrasound therapy, because the ultrasound therapy has a function that can deal with the scar and make the scar disappear. So ultrasound therapy. Also, we have electricity therapy. Electricity therapy. Do you know Li Xiaolong? Li Xiaolong. Li Xiaolong is a kung fu actor, right? Kung fu actor, and when he training the muscles, he not only do some strength training, but also he will do some electricity stimulate of the muscles. So the electricity electricity stimulation can make our muscles bigger. And also some electricity treatment can release the pain of our body. For example, I believe that many of you have suffered from neck pain or low back pain, right? If you have ever suffered from this pain, you can type neck pain or low back pain on the chat box. I want to know how many of you have ever experienced such pains of your body. Neck pain, shoulder pain, or the knee pain, or the low back pain. Any pain you have ever suffered, you can type your experience on the box. Low back pain, 你想? Yes, I know, low back pain. I think maybe many of you who have low back pain, he just has a very bad habit. Yeah, a lot of you, low back pain 3. Oh yeah, 娜林永富 low back pain. I believe that many of you who have low back pain may have a bad habit, that is to sit for a very, very long time. Maybe sit just for half of the day or even the whole day, right? Maybe you are sitting just do something about your studies, or maybe you just sit there to use your computers or just write some papers. So you need to sit for a very long time. We call it a sedentary habit. Sedentary, S-E-D-E-N-T-A-R-Y, sedentary habit. It is called sedentary habit. That means when you sit for over than 2 hours, maybe you will have the disease of the neck pain or low back pain. So we also tell our patients who have low back pain that every time when you study or work for 1 hour, you need to stand up and do some exercise of your shoulders and of your neck and of your back. And you know, one class is about 45 minutes. So there, after one class, you will have 10 minutes to rest. During the 10 minutes, I hope that you can stand up from your bed or stand up from your chair to do some exercise, and you can do it with me. I will teach you mechanic treatment to deal with the low back pain. So if you have the sedentary habit, have the low back pain, we can use electric therapy to deal with the pain. Some electric therapy, especially the low frequency electrotherapy, can release the pain. And also some other such as the phototherapy, that means use the light, but the light is not the light in our home, and also not the light in your dormitory. It is called phototherapy. We use such as the infrared therapy or the blue and violet light therapy or ultraviolet therapy to deal with the pain or some other disease. So if you know something about physical factors therapies, you can deal with some of your own problems, and you know how to choose different physical factors to deal with different disease. The last one, understanding the development of physical therapy. Understand the development of physical therapy. So first of all, we are going to study the definition of physical therapy. Physical therapy means we use functional training. Functional training is also called movement therapy, and the physical modality therapy, such as sound, and such as sound. Yes, we can use sound. That is ultrasound therapy. We can use light. That is called phototherapy. And we can use electricity. That is called electrotherapy. Also, we can use magnetism, heat, and these kinds of physical factors we can use. It is called physical modality therapy. And the first one is functional training. It's also called movement therapy, right? This is movement therapy. The second one is physical therapy, physical modality therapy. And the third one is manual therapy. So physical therapy through these three therapies: functional training, physical modality therapy, and manual therapy to improve the overall function and symptoms of the human body. It is also called 3M therapy abroad. So you know why it is called 3M: movement, right? Modality and manual. That is the physical therapy, the definition of physical therapy. So it is very easy, right? The first picture shows you movement therapy. The physical therapist is teach the patient how to walk correctly. And the second one shows the modality therapy. Modality therapy, the patient is receiving electricity therapies on the legs. From this picture, maybe the patient have some, maybe it is a patient after stroke, because the electrode sheet, this is the electrode sheet 1, 2, 3, 4. You can see 4 sheet, right? Electrode sheet is on the leg. 股四头肌 ，Do you know 股四头肌 ？Quadriceps. Quadriceps. The sheet is on the quadriceps, and another 2 sheets on the tibialis anterior, right? Because the people after stroke, they have very weak muscles. Maybe the muscle strength is in level 2 or even less than level 2, maybe 0, 1, or level 2. So they need this kind of electric stimulation to improve their strength of the muscles. So we put the electrode sheet on the tibialis anterior. This is tibialis anterior, and this is quadriceps. Because a patient after stroke, if he want to stand and if he want to walk, he must have very strong muscle strength of the leg, right? Of the upper lower limbs. So a patient can stand the strength of the muscle, the strength, the quadriceps strength, at least need to reach level 3. So he can stand up from the bed. So we need to do this electric therapy to the muscles. And the last one is called manipulation therapy, also called manual therapy. Manual therapy means massage, right? Massage, or